Hi, I'm Justin Bovin, and I'm going to be presenting on the physiology of bronchitis. Now, the lungs are the most affected organ when dealing with bronchitis, and more specifically, the conduction zone. Now, when looking at the conduction zone, this is primarily used to filter the air and move the air throughout the lungs. It is important to note that there is no gas exchange occurring, and the conduction zone consists of the bronchi, bronchioles, and the trachea. So again, no gas exchange is occurring. So if you look on this diagram here, you will see that their air can pass through the nasal cavity, enter the pharynx, then the larynx, and then go down the trachea. Now once you reach the end of the trachea, there are two primary bronchi. Now these bronchi will later split into bronchioles, and these bronchioles will later split into alveoli. Now what we're looking at here mostly is the bronchioles. So if we take a look at bronchioles, these are mainly used again for air distribution throughout the lungs. So there's also a mucus lining around the bronchioles as well as the respiratory tract in general. And this mucus lining is used to help defend the lungs of a foreign pathogen or bacteria that comes from the external environment. So let's say a bacteria comes through the respiratory tract and reaches the bronchioles. Now, what the mucus lining can do is trap that bacteria in the mucus and bring it up, and is later coughed out or sneezed out, evacuating that said bacteria. So again, mucus lining is a very important role in keeping the lungs' respiratory tract safe. And these bronchioles also contain smooth muscle, and this smooth muscle is involuntary, and this smooth muscle can be used to constrict or dilate the airways. Now, when it's constricted, that means the air is going to be harder to breathe, as it is more narrow. And when dilated, it will be easier to breathe as it opens up a little more. And when looking at different tests, you can choose an x-ray. Now what an x-ray does is helps figure out where in the lungs this certain thing is happening in. And what this can do is weed out different diseases such as pneumonia or COPD that can be commonly misunderstood for bronchitis. And this really just helps pinpoint what disease we're looking at. And another test is the sputum test. What the sputum test does is it takes a sample of your mucus, also known as sputum, and it tests to see if there are any bacteria living on that sample. Now, if the test comes back positive, that means that you will have bacteria that is present on that mucus sample, meaning that you might have bacteria that is causing infection. Now, an example of this is Staphylococcus aureus, which is one of many bacteria that can be found in the respiratory tract. And finally, another test that can be used is the spirometry test. And this test kind of helps show the basic functions of the lungs, such as the normal breathing rate, how much the maximum amount of air that can be inhaled in the lungs, and the maximum amount of air that can be exhaled. Now, what this shows is how the lungs are being affected because of a certain disease or a certain illness. So this, again, can kind of show that the patient is dealing with something here. Now, there are some risk factors to bronchitis. One main risk factor is smoking, and around 40% of smokers will develop bronchitis, any form of bronchitis, in their lifetime. And this is due to the nearly 7,000 toxins that are found in a single cigarette. Now what these toxins do is damage the lungs, they damage the tissue, and they constrict the passageway for air and constrict the bronchioles, and making it harder to breathe and making you more susceptible to an infection. And as well as alpha 1. Now, alpha 1 is a protein that is mainly used to inhibit inflammation in the lungs, and more specifically in the bronchioles. Now, if you have an alpha 1 deficiency, which is a genetic disorder, you will not be able to inhibit that inflammation, meaning that inflammation might happen more easily when an airborne pathogen enters, meaning that you're at a higher chance of getting sick and getting a disease, as you cannot inhibit that inflammation. And again, this is a genetic disorder that is passed down from an abnormal gene from both parents. This meaning this alpha 1 deficiency is not as common as smoking, and around 100,000 Americans have this deficiency. And a common myth when speaking of the lungs is what triggers breathing. So the main thing that people think of when breathing is oxygen, where we must be low in oxygen, we must need more oxygen in the blood. While this is true sometimes, the main reason that we are triggered to breathe is because of the carbon dioxide levels in the blood. Now, the carbon dioxide, when increased in the blood, will decrease the pH in the blood, causing the pH to become more acidic. And an increase in breathing rate will decrease the amount of carbon dioxide in the blood, because what we do is inhale oxygen and exhale that carbon dioxide. So when that carbon dioxide is exhaled at a faster rate, we can increase the pH back to its normal range of about 7.4. So that's one common myth that is talked about when breathing. And here is my vocabulary slide, and here is my citation slide. Thank you very much, and have a blessed day.